So my name's Cody Moe, and I will be doing my presentation over measles virus. Measles is also known as rubeola, which is not to be confused with rubella, which is a completely different disease. So the causative agent of measles is morbillivirus measles virus, and this comes from the Paramyxoviridae family. It shares a family with the mumps virus, and it is the only species of morbillivirus that can infect humans. It's a negative sense single-stranded RNA virus. It's spherical in shape and it is enveloped. So the modes of transmission for measles are both contact and airborne. Coughing and sneezing are common symptoms for measles, and this allows for droplets to spread the disease. One of the reasons that measles is so contagious is that the virus can survive for 2 hours on surfaces outside of the body. If someone breathes in the airborne particles or touches an infected surface before touching their eyes, nose, or mouth, they will contract the disease. 90% of people who come near an infected person will contract the disease if they have not been vaccinated. This provides for an R0 of 12 to 18, and this means that we expect to see someone infect 12 to 18 other people once they have contracted the disease. So for signs and symptoms, these will fall into 4 stages of the disease. The first is a 7 to 14 day period right after coming into contact with the virus, and it's the incubation period, and this is where it's going to replicate unnoticed in the body. After the incubation period, it enters the prodromal stage, in which a patient experiences high fever, and what they call the 3 C's. The first is cough, the second is conjunctivitis, and the third is coryza. Conjunctivitis is inflammation of the white part of the eye, which causes it to turn red and look like the top picture here. And coryza is inflammation of the mucous membrane in the nose, which causes a stuffy nose. It then moves on to the enanthem stage, in which the hallmark Koplik spots develop. These are white spots on the inside of the cheek, as seen in the middle picture here. And this is followed by the exanthem stage. This is where we see the external rash, and it has a cephalocaudal progression, meaning it starts at the head and works its way out to the extremities. And then here we have the timeline for the disease. We see the incubation period lasts around 14 days, and it's followed by 3 days of our fever, cough, and swelling. Enanthem is technically part of the prodromal stage, but it's only present for 1 to 2 days rather than the full 3 days of the prodromal stage. The rash will actively spread for 4 days before beginning to fade away over the next 10 to 14 days. Measles are contagious 4 days before and 4 days after the rash starts, with it being most contagious while the patient has the fever and the cough. So the virus starts off by infecting the epithelial cells of the tracheae or bronchi. It binds to the epithelial cells using a surface protein called hemagglutinin, and this binds to one of 3 receptors, which are going to be the CD46, the signaling lymphocyte activation molecules, or SLAM, and Nectin-4. CD46 is found on all nucleated cells. SLAM is found on B cells, T cells, and antigen-presenting cells. And then Nectin-4 are found on cellular adhesion molecules, but they're not as related to the virus in humans. The fusion protein found on the viral envelope will allow it to fuse with the epithelial cell and inject the viral RNA into the cell. So once the negative sense single-stranded RNA enters the cell, it must be transcribed into positive sense mRNA. From there, it can be translated into viral proteins and form a new envelope out of the cell's lipid bilayer. It leaves the cell and is picked up by dendritic cells and alveolar macrophages. These will carry it to local lymph nodes where it further travels to the blood. It is then spread in the blood to other areas such as the intestines and the brain. So lastly, we will talk about the vaccine and treatments. So the measles vaccine was first developed as a three-part vaccine that also covers mumps and rubella. Recently, a new vaccine has been developed that includes the varicella, which is chickenpox. The vaccine is attenuated, so it is altered so that it is harmless. It gives 97% immunity from measles after the second dosage, which most people will receive anywhere from age 4 to 6, while their first dose should be from 12 to 15 months of age. As early as the 7th century, measles was so common that people believed it to be a normal life event that all children went through. But the vaccine has caused the number of cases to drop 99% once it was introduced, to the point where it has been declared eliminated from the US, although not fully eradicated. Measles was close to being eradicated if it weren't for the anti-vaccine movement started by Andrew Wakefield's vaccine hoax. Now, measles only enters the US from those who contract the disease in other countries and spread it to communities that do not have large populations of vaccinated people. Aside from the vaccine, there is very little treatment for the disease. Both the vaccine and immunoglobulin from vaccinated mothers can provide resistance up until 72 hours after the disease is contracted. And then vitamin A is given to anyone thought to have a vitamin A deficiency, as good levels of vitamin A will serve to mitigate the severity of the disease. Fever reducers such as Tylenol are used to control the symptoms. And then lastly, antibiotics can be given to immunocompromised patients who can sometimes experience other medical conditions such as bacterial pneumonia as a result of contracting measles. And that is my presentation. Thank you.